How does drug distribution work for first-year med students? Imagine you take a pill and wonder how it travels through your body to reach its target. That journey is what we call drug distribution, and it's a key part of understanding how medicines work. When a drug enters your bloodstream, it gets carried all over your body through the blood vessels. But it doesn't just float around aimlessly. It moves into different tissues and organs based on several factors. One important concept is the volume of distribution. Think of it as how much space the drug seems to occupy in your body. If a drug has a low volume of distribution, it mostly stays in the blood. If it's high, it spreads out into tissues like fat, muscle, or even bone. This helps doctors decide how much medicine to give and how often to give it. Another big factor is plasma protein binding. Many drugs stick to proteins in your blood, like albumin. Only the free, unbound drug can cross cell membranes and do its job. If a drug binds tightly to proteins, less of it is active at any one time. But if a person has low albumin levels, more free drug is floating around, which can increase effects or side effects. Blood flow is also important. Organs like the liver, kidneys, and brain get more blood, so drugs reach them faster. Some tissues have tight barriers like the blood-brain barrier, which keeps out many drugs. Lipid-soluble drugs cross cell membranes more easily than water-soluble ones, so they tend to distribute more widely. Some drugs also accumulate in fat or bones, which can make their effects last longer. Understanding these ideas helps in predicting how quickly a drug acts, how long it stays in your system, and what side effects might happen. For example, drugs like warfarin bind to proteins and need careful monitoring. If a patient has low albumin, the free drug level can rise, increasing bleeding risk. Distribution is just one part of pharmacokinetics, which also includes absorption, metabolism, and excretion. As first-year students, learning these basics helps you grasp how drugs reach their targets and how various factors can change their effects. So, next time you think about taking medicine, remember that it's not just about the dose but also how it moves through your body to do its job.